Syncope is temporary loss of consciousness caused by inadequate or lack of supply of blood to the brain, which means that oxygen rich blood is not able to reach the brain on time. Syncope is more commonly known as fainting. Commonly in children, mostly preteen or teenage years, which is mostly rarely below the age of 6 years of age, uh, this condition is more commonly seen. 20% of children will experience at least one episode of fainting before the end of their adolescence. The child may lose consciousness, sometimes fall, or rarely have short seizures or convulsions. Now, while different problems can cause decrease in blood flow to the brain, there are two most common types of syncope. The first one is called vasovagal syncope, or in medical terms, neurocardiogenic syncope. Now, this is the most common type of syncope. A variety of situations can stimulate the vagus nerve, which is a nerve which supplies from the brain to the heart, and this can lead to slowing of the heart rate and dilatation of the body's blood vessels, i.e., making them look big. Now, while the slow heart rate and dilated blood vessels occur, less blood goes to the brain, and as a result, the child or patient might faint. Pain, anxiety, panic attacks, or emotional stress can all be triggers of vasovagal syncope in certain patients. This type of syncope can also be seen often in some families, so there is a familial pattern. Now, the other common type of syncope is called orthostatic hypotension, which means that your blood pressure drops when you get up from sitting or lying down position into a standing position. So, if the blood which pools the legs or supplies blood to the legs prevents the normal blood from reaching the brain when you suddenly stand up from sitting position, and this can momentarily cause to drop the blood reaching the brain and make you faint. Rarely, syncope can be a manifestation of a heart problem. So, syncope can present itself as a spectrum of symptoms. Most of them are very short and do not lead to anything complicated. We can divide syncope into three types: near or pre syncope, or very mild syncope, where a patient feels dizzy, lightheaded, the room might appear to be spinning around them. They're about to pass out or faint, but not actually faint at all. Sometimes sitting or laying down or drinking some water can prevent these types of symptoms from happening again. There is enough warning for the child to sit down or lie down. The other form of syncope is called full syncope, where there's reduction of the blood supply and oxygen to the brain, and this is long enough to cause fainting. The child might fall, and that might be leading to unconsciousness or unresponsiveness for a few seconds. And finally, the child might also have something called a seizure or a convulsion. Now, occasionally, a full syncope, which is prolonged, mostly more than 3 to 5 minutes, can result into a seizure or a convulsion, where their muscles contract, causing the body to move uncontrollably. It is very short lived, but sometimes it can take several minutes to recover, and most often it is not complicated by any other problems. Now, if a seizure is caused by a problem in the brain, it is a very different presentation and it's not similar to with what occurs during syncope. So, children should try and recognize the initial or early signs of syncope, especially if they are getting them very often, and try certain interventions on their own. They should avoid dehydration, for example, take enough water and fluids, maintain a good diet, a regular diet rather than just binge eating from time to time, avoid long periods of standing or irregular meal times. Other simple measures could include taking enough salt intake to make sure that they've got enough hydration and water contents, and try and sit down or slowly sit up or stand up if they feel that they're feeling faint. Now, when syncope persists, despite some of the behavioral issues, medical therapy can also be used to treat it. But for this, they should approach a pediatric cardiologist and seek specialist attention. No, syncope should not affect your brain function. However, if a child has a seizure due to a either a prolonged syncope, it could be related to a brain problem rather than just non cardiac syncope. And in that case, they should seek specialist advice to ensure that there is no long term effect on the brain. So, if a child loses consciousness from fainting, has a seizure which is fairly long duration, then they should go and see a doctor. It's never normal for a child to lose consciousness without a reason. So, if the child keeps on having fainting episodes frequently, they should certainly go and see the doctor. Uh, every child should be evaluated depending on the severity of the condition. Now, if there is an underlying condition such as a heart disease that is causing syncope, their doctor should refer them to a specialist pediatric cardiologist for further evaluation and treatment. Now, treatment for syncopes and seizures are very different. So, it is important for the doctors to ensure that the child is not actually having seizures related to a brain problem and it is just part of the presentation from syncope. Uh, it is difficult to say certain preventative mechanisms might help to reduce the frequency of syncope. As previously stated, uh, patients or children should try and stay hydrated. They should take enough salt and good diet intake and eat regularly rather than irregular meals. They should be aware of the signs of syncope so that they can take measures before the actual symptoms occur. They should avoid triggers like cardiac stimulants, caffeine, etc., which would hopefully help them reduce the frequency of the symptoms. Some children or patients will benefit by wearing compression stockings, which would also help better blood pressure control and allow the symptoms to be less uh, uh, obvious. If syncope is ongoing, and as previously mentioned, they should be referred to a pediatric cardiologist. Depending on the history, the pediatric cardiologist might decide to do some specific test, like blood tests to look for blood sugar and hydration and some electrical electrolytes. They will do an electrocardiogram, which is a test which will look at the electrical activity of the heart to see if there's any abnormal rhythm. They will perform an echocardiogram, which is an ultrasound scan of the heart to make sure that the heart is moving well and there's no inside problem within the heart for valves or holes in the heart. And finally, they might do a long monitoring of the ECG called a Holter monitor to look at the rhythm of the heart again.